Hi, hello again, and welcome to Biocytogen's webinar series. It's nice to meet you all online. It looks like we are ready to begin, so let's get started. My name is Xiaoshen, and I'm the marketing specialist at Biocytogen Beijing. I'll be serving as your moderator for today's session. So today's session is titled From Obesity to Cardiovascular Disease, Preclinical Mouse Models Accelerating Therapeutic Discovery. So we'll be talking about how advanced humanized models and in vivo disease models can help move drug discovery forward for obesity and cardiovascular disease. It is my great honor to introduce today's speaker, Dr. Jinyi Ma. Dr. Jinyi received her PhD in Tianjin Medical University, majoring in mechanistic study of pyroptosis and the development of single-domain antibody screening. She subsequently joined Biocytogen as a product manager in the Biomice product development. Dr. G manages the development of humanized mouse models for metabolic diseases and small nucleic acid therapeutics. A series of humanized mouse models has been successfully implemented across diverse therapeutic areas, including cardiovascular diseases, obesity, diabetes, and non-alcoholic steatohepatitis (NASH). In today's talk, Dr. Jinyi will walk us through some of the latest advances in obesity and cardiovascular disease, including pathways like GLP-1 and ACTR2, as well as emerging targets such as LPA, PCSK9, and ANGPTL3. She will also share some key studies using our in vivo and humanized mouse models, including high-fat diet or Western diet-induced models and some muscle preservation models. So now I would like to invite Dr. Jinyi to begin her presentation. Just a quick reminder, participants may ask their questions in the Q&A box or drop us an email, and our representative would address the questions by email respectively. Thank you, and I hope you enjoy the presentation. Let's welcome Dr. Jinyi.
Hello everyone, my name is Sima. I'm the product manager from Biocytogen, and today I'm really happy to be here to introduce our mouse models for obesity and cardiovascular disease. So let's start now. And here's some topics today. And today I will focus on our humanized models for obesity, cardiovascular disease, as well as I will also introduce our pharmacology platform. So, okay, let's begin to introduce our mouse models for obesity. So here's some introduce and briefly background here. We can see from 2020 to 2025, there were around about 7,000 drug pipelines for metabolic disorders, and including obesity, cardiovascular disease, diabetes, cardiovascular disease, chronic kidney disease, and MASH disease. So we know because of the irregular lifestyles or more than stressful, more and more people around the world becoming overweight, and more than 100 million in US and more than 1 billion in worldwide. So as far as now, there were around more than 200 drug pipelines around the world for obesity, and more than 100 were GLP-1 related drugs. And also in 2025, there were around GLP-1 receptor agonist drugs have surpassed PD-1 and PD-L1 inhibitors, becoming the best-selling drugs in the world. So let's do a quick review about these three popular targets, GLP-1R, GIPR, and GCGR. And so we know GIPR and GLP-1 are both the incretin hormones secreted by the small intestine. And we know GIP is released by the K cells, and GLP-1 is released by the L cells. So GLP-1 combining with GLP-1R and trigger insulin release, suppress the glucagon secretion, and slows the stomach emptying. And GLP-1 can also affect your brain and leading a feeling of fullness and reduce the appetite. GIP also can promote insulin secretion and reduce the appetite. And what is special is that GIP and can act on GIPR on the adipose tissue to promote the fat accumulation. So GCGR is the receptor of the glucagon, and its activation can promote the blood glucose increase. And the most important is that GCGR activation can promote the lipolysis. So we develop a series humanized single target GIPR, GLP-1R, GCGR mouse models, and we also cross them to build some double target or triple target mouse models for different drug evaluation. So our first case is about our humanized GLP-1R mice. Our gene targeting strategy was the full coding sequence of GLP-1R was inserted into the mouse GLP-1R. And the mouse GLP-1R gene's translation and transcription will be disrupted. And in the protein expression analysis, we conduct IHC study by using a human-specific GLP-1R antibody and mouse-specific GLP-1R antibody. And we can see in the IHC result, human GLP-1R can only detectable in our humanized GLP-1R mice, but not in wild-type mice. And in mouse GLP-1R was only detectable in the wild-type mice, but not in our humanized mice. And we also conduct some in vivo functional analysis. In this study, we conduct APGTT study. And in our humanized mice and wild-type mice, we treated these mice with a human-specific small molecule drug, danuglipron. And we can see during the APGTT, danuglipron can promote the insulin secretion from our humanized mice. And it also can reduce the blood glucose, which means danuglipron can improve the glucose tolerance and promote insulin secretion from humanized GLP-1R mice. And next, we establish a DIO model in the humanized GLP-1R mice by a high-fat diet for 12 weeks. And after establishment, we treated these mice with semaglutide. And we can see from figure A to figure B, semaglutide can reduce the body weight compared with the high-fat diet control. And it also can reduce the food intake. And during the treatment period, we also record the fasting blood glucose every week. And we can see semaglutide can also reduce the blood glucose compared with the control vehicle group. And at endpoint, we also conduct an IPGTT study to see semaglutide can improve the glucose tolerance compared with the vehicle group. And in the insulin analysis, we also can see semaglutide can alleviate the insulin resistance, which means our humanized models is a great models to evaluate some semaglutide or some drugs for obesity study. And this figure shows some represented images for our humanized models after a high-fat diet induction and after semaglutide treatment. And we also can measure the adipose tissue weight. And we can see after semaglutide treatment, it can reduce different adipose tissue weight. And beyond body weight loss study, GLP-1R related drugs are now expanding into the MASH field. We know GLP-1R is not expressed in the hepatocyte, but it can alleviate MASH by indirectly regulate the whole body metabolism, and it also can act on the macrophage. It can switch macrophage from M1 type macrophage to the M2 type macrophage. And it also can act on the T cells to increase the Treg cells, which can inhibit the fibroblast activation to alleviate MASH. So we collaborate with our client to conduct CDA-HFD mouse mesh model. And in this model, mouse will not be obesity and insulin resistance, but mouse will develop inflammation and liver fibrosis. And after establish this mesh model, we treated this mice with orforglipron and semaglutide. And we can see these two drugs can significantly reduce the NAS score of the inflammation, which means our humanized mice can be used for the obesity and MASH study. And we also developed a humanized GIPR mice. And in this mice, we also replaced the mouse GIPR with human GIPR. And in the in vivo functional study, we treated this mice with a GIP recombinant protein and conduct IPGTT. And we can see after treated with GIP during the IPGTT, it can promote insulin secretion and reduce the blood glucose. And in another study, the group 3 mice was treated with GIPR antibody before treated with GIP. And we can see GIPR antibody can alleviate the insulin secretion promoted by human GIP. Which means after humanization, our mouse models can exhibit normal and have a normal phenotype. So we also fed these mice with high-fat diet to induce DIO, and we treated this mice with in the group 3 was GIPR antibody, and group 4 was semaglutide, and G5 was a combination. And we can see when we combine GIPR antibody with semaglutide, it can show the most body weight loss effect compared with the single semaglutide or GIPR antibody. It also can reduce the food intake, and also in the IPGTT study, we can see it can improve the glucose tolerance. And in addition to the single target, we also have the triple target humanized CGR, GIPR, and GLP-1R mice. And we treated this mice single GLP-1R agonist, orforglipron, semaglutide, and the double target, double GIPR and the GLP-1R agonist, tirzepatide, and the triple target retatrutide. And in this study, we can see retatrutide shows the most body weight loss effective compared with the tirzepatide or orforglipron and semaglutide. And we know these drugs are really positive and popular, but it also have some side effects such as muscle loss. So there are some drugs. There are some drugs in the TGF-beta signal pathway for muscle preservation, such as some ligands like Activin E, Activin A, and GDF8. They are reported with muscle preservation and lipolysis. So in this signal pathway, they can force binding with the type 2 receptor, like ACVR2A and ACVR2B. And they can transmit the signal from ALK4, ALK5, and ALK7. So this table shows the drug targets for the muscle preservation, and the drug type include siRNA and antibody drug. And so the first target I will introduce is myostatin, also called GDF8. It can inhibit the muscle growth from this TGF-beta signal pathway. And we also developed humanized GDF8 mouse models. And the gene targeting is also the gene replacement. We replace the mouse GDF8 gene with the human GDF8. And in this study, we also fed these mice with the high-fat diet. And in this model, we treated these mice with in the group 3 with the single semaglutide, and in the group 6 with the single GDF8 antibody. And we also combined the GDF8 antibody with semaglutide in G4, G5, and G7. And during the dosing period, we using our body composition analyzer to measure the lean tissue and the fat tissue. And we can see in the figure B, the group 6 GDF8 antibody can show a significant lean tissue growth compared with the start. And in the group 3, single semaglutide can show the most lean tissue loss compared with the start. And when we combine the semaglutide with GDF8 antibody, it can alleviate the lean tissue weight loss. So our humanized mice, humanized GDF8 mice, was a great model for the muscle preservation study. So beyond the antibody drug, there are also some drug target for siRNA drug, such as INHBE and ALK7 is really popular and important drug. We know INHBE mRNA encode a protein called Activin E, and it can secreted from the liver and binding on the adipose. The receptor was ALK7, and it can inhibit the lipolysis. So we developed humanized INHBE mice by replacing the mouse INHBE with the human INHBE genome sequence. And in that, we treated these mice with a single dose siRNA drug target INHBE, and we collected liver in the days 14. And after that, we measure the mRNA level of INHBE in the liver. We can see this siRNA drug can significantly reduce the mRNA level of INHBE. And we also fed these mice with a high-fat diet to build a DIO model. And after induction, we treated these mice with an siRNA drug, which can target INHBE. And we can see in the figure B, the saline group, the body weight can significantly increase. In contrast, after we treated with this siRNA drug, it can significantly inhibit body weight growth compared with the saline group. And we also can measure the liver TC, liver TG, and the liver TC. And at the end point, we do the 3D reconstruction analysis by micro-CT. We can tell the lean tissue and adipose tissues. We can see after siRNA treatment, the lean tissue weight will not reduce. And in the contrast, the adipose tissue weight shows a significantly reduced compared with the saline group. And this slide shows represents images from the micro-CT. And we can see our humanized mouse model was suitable for the obesity studies. And we also developed INHBE's receptor, ALK7's humanized models. The mouse ALK7 was replaced by the human ALK7. And we also treated this mouse with siRNA drug in a single dose. And at day 14, we collect the adipose tissue to measure the mRNA level of ALK7. And we can see after treatment, the siRNA drug can significantly reduce mRNA level of ALK7 in different adipose tissue. which means our humanized models is suitable for this SIR drug evaluation, not only in the liver, but also in the adipose tissues. And beyond, I just introduced the ligand or type 1 receptors. The actin type 2 receptors is also an important target for muscle preservation, such as the benchmark is bimagrumab. This drug is an antibody that can block the actin type 2 receptors like ACVR2A and ACVR2B to promote the muscle growth and fat reduction. So we conduct study by using the Y-type DIO mice. And in these models, we measure the lean tissue and fat tissue by using our body composition analyzer at the beginning and at the end point. And during the treatment period, we treated these mice with single semaglutide and also the combination with bimagrumab. And we can see the lean tissue change. Semaglutide shows the most lean tissue reduction. In the contrast, after we combine with the BIMA, this drug can alleviate the lean tissue loss compared with the semaglutide. So we develop humanized ACVR2A and ACVR2B mice. But the targeting strategy, also the gene replacement, we replace the mouse ACVR2A and ACVR2B by human genome sequence. And we also validate these models by using the qRT-PCR. And we can see in our humanized mice, there was only human ACVR2A and ACVR2B, but not mouse gene expression. And we know in addition to the antibody drugs, we also have some clients doing some siRNA drug. So we collaborate with our client. We test an siRNA drug which can target ACVR2B both in adipose tissue and muscle tissues. We treat these mice with siRNA drug, a single dose, and at the end point, we collaborate the fat adipose tissues and muscle tissues to measure the mRNA level of ACVR2B. And we can see the siRNA drug can significantly reduce the mRNA level of ACVR2B. And here was the product list for our humanized models for TGF-beta signal pathways. And in addition to Activin E, we also have Activin A, Activin B, and Activin C. And we also have some double target or triple target mouse models for some, such as double target drugs or multi-target drugs for different mechanism or some different methods to evaluations, such as TFR1 and humanized GDF8 models maybe can use for some AOC drugs evaluations. So the next part, we can jump into our cardiovascular disease. We know some like high blood lipid levels. Also, we can call it like hyperlipidemia, are also closely with cardiovascular disease. And it can lead to some development of atherosclerosis, which has a high mortality risks. So the lipid management is really important for our health. And this figure shows some important lipid lowering target for some like PCSK9 is for regulate the LDL-C target, and ANGPTL3 and APOC3 can for the triglyceride target. And LPA, which was independent risk factors. So we developed a series humanized models for this target. And the first one I will introduce is about PCSK9. And the most important benefits for inhibit PCSK9 is the reduction of LDL-C. And PCSK9 inhibitors, the mechanism is it can regulate the LDLR expression on the liver, and it can improve the clearance of LDL-C. And target PCSK9 include antibody drug and siRNA drug. And we know inclisiran, which is first-in-class siRNA drug for lipid lowering. So here was our humanized PCSK9 mice. And in these mouse models, well, we treated these mice with Western diet to induce LDL-C increase, and we can see after induction, LDL-C's concentration and the total cholesterol concentration was significantly increased compared with the control group. And after that, we treated these mice with 2 antibody drug, which can target PCSK9. And we collect the blood at different time point to measure the LDL-C and TC. And we can see these 2 drugs can significantly reduce the LDL-C and TC level. And in addition to the antibody drugs, we know inclisiran, which is a siRNA drug, it can target PCSK9's 3' UTR. So we develop a next version, PCSK9 Mice Plus. And in these models, we replace the mouse PCSK9 with human PCSK9 genome sequence and include the promoter, 5' UTR, and 3' UTR. And in these models, we treated these mice with a single dose, and we collect the blood at different time point. And we can see this siRNA drug can significantly reduce the PCSK9 at different time point, which means our humanized PCSK9 mice is suitable for both siRNA drug or antibody drug. And the next target I will introduce is lipoprotein A, which is an independent risk factors. And for structure, lipoprotein A is an ApoB containing like LDL-like particles and binding with ApoA. And due to the presence of ApoA, lipoprotein A shows a greater tendency to induce the atherosclerosis compared with the LDL-C. So because of ApoA should binding with ApoB, so we develop a double humanized LPA and ApoB mice. And in these models, we treated these mice with a small molecule drug and siRNA drug. And we can see both 2-time drug can reduce LPA complex level. And just as that, LPA structure is really similar with LDL-C, so it also can clearance from the LDLR. And according to some report of PCSK9 inhibitor, in addition to lowering LDL-C, PCSK9 inhibitors such as antibodies or siRNAs also can decrease the levels of LPA. So we develop a triple humanized LPA, ApoB, and PCSK9 mice. And in these models, first we treated these mice with in the groups 2 was LPA target siRNA olpasiran, and group 3 was PCSK9 siRNA inclisiran, and group 4 was their combination. And we can see olpasiran can reduce the level of LPA, and inclisiran can reduce the level of PCSK9, and it also can reduce the level of LPA, which is consistent with the clinical report. And next, we treated these mice with Western diet to induce LDL-C increase. And after that, we treated these mice with olpasiran, inclisiran, and their combination. And we can see after treated with olpasiran and inclisiran, it can reduce the level of LDL-C, and their combination has a more greater reduction of LDL-C level, which means our humanized LPA, APOB, and PCSK9 mice can do is suitable for the study of lipid lowering. And we know due to the dysregulation of lipid metabolic can initiate the thrombosis. And in the right, we list some traditional therapy method for thrombosis treatment, such as heparins, vitamin K antagonist, direct oral anticoagulants, but they also have some limitations. The most important risk is bleeding risks. And factor H, factor 11, which in the coagulation pathway is a key regulator in the intrinsic pathway, but is not in the extrinsic pathway. We know intrinsic pathway is associated with the thrombosis formulation, and the extrinsic pathway is associated with the physiological homeostasis. So F11 is essential for thrombosis, but can avoid the bleeding risks. So we develop a humanized F11 mice. And in these models, we also replace the mouse F11 with the human F11 genome sequence. And we also treated mice. First, we treated these mice with an siRNA target F11. And at the end point, we measured APTT. We can see the siRNA drug can significantly reduce the level of 11. And the APTT at endpoint show a significantly increase, which means this siRNA drug can inhibit the intrinsic coagulance pathway. And then we treated these mice with different dosage of antibody drug, which can target F11. And we also measured APTT at day 1 and day 9. And we can see this antibody target F11 also can increase the level of APTT, which means this antibody drug can inhibit the intrinsic coagulant pathway in this F11 mice. And next, we also develop humanized F12 mice plus. And in these mice, we also treated with an siRNA drug and tested APTT level. And we can see this siRNA drug also can reduce the expression level of F12 and increase the level of APTT. And the next actually is the last disease I will introduce is cardiomyopathy. And cardiomyopathy is a disease maybe can affect your myocardium and can make your heart stiffen, enlarge, or get thickened, and make your heart can't pump blood of efficiency to the rest of your blood. So we developed 2-type cardiomyopathy disease models. The first one is hypertrophic cardiomyopathy, and the second one is dilated cardiomyopathy. And we know the dilated cardiomyopathy is also related with some virus infection or because of the alcohol. And hypertrophic cardiomyopathy is always most of the hypertrophic cardiomyopathy is a genetic disease and caused by some gene mutations, and it will involve your heart muscle formation. And the two main mutations genes are the M1BPC3 and M1H7. And here we develop a M1BPC3 knockout mice, which is a hypertrophic cardiomyopathy disease models. And in these models, we can conduct HE staining, which shows the cardiac enlargement, ventricular wall got thickened, and ventricular dilations. And we also can conduct Masson staining, which we can see the fiber proliferations, and which is consistent with the phenotype of the hypertrophic cardiomyopathy. And here was the product list for our cardiovascular disease. And we developed a series humanized models for different targets, like ANGPTL, such as ANGPTL3, ANGPTL4. And we also developed some targets like PCSK9, LPA, APOC3. And we also developed some models for heart failures, for hypertension or thrombotic. And we also developed some disease models and double target models or multi-target models. And at the last, I will introduce our pharmacology platform. And this slide shows the overview of our metabolic disease models. Here is our capabilities for different disease, such as obesity disease, MASH disease, liver fibrosis, acute liver injury, hyperlipidemia, and hyperuricemia. And we also have some plan to develop hypertension or cardiomyopathy disease models. And in addition to metabolic disease, we also can do some services in tumor or immune reconstitution models, autoimmune disease, or neurological disease. And we also can do some services in vitro, ex vivo, or some IHC, HE detections. And in addition to the mouse models I introduced today, we also have a more comprehensive product list for different targets in different disease areas. And you also can combine with our pharmacology platform, and our detection platform can help for your preclinical research. So today is my topic and introductions. So if you have any questions, we can jump into the Q&A section.
Thank you for your time and thank you for joining this webinar by Biocytogen. That's all for the presentation by Dr. Jeannie. If you have any question to us, please drop us an email at info@biocytogen.com.cn and our representative will reply you shortly. You may also scan this QR code to know more about Biocytogen from our official website. Thank you once again and I hope to see you next time. Goodbye.